Welcome to All Things Policy, a daily podcast by the Takshashila Institution. We are a bunch of policy nerds based in Bengaluru, and we like bringing fresh perspectives to Indian affairs and Indian perspectives to global affairs. So grab a cup of coffee, sit back, and join us for today's chat.
Hi, and welcome to another episode of All Things Policy. My name is Malathi Renati, and I head the policy school at the Takshashila Institution. The topic for today's discussion is policy planning for India's elderly. And I have with me my colleague Sowmya Prabhakar. She's the Chief Operations Officer here at the Takshashila Institution. And the reason why I wanted her to be part of this discussion was we both are quite familiar with the growing challenges for the elderly, as we have first-hand experience being primary caregivers for both our in-laws and parents. So we will share not just our personal experiences as we look at ways in which we kind of improve the overall quality of life, but for the seniors, but also we'll look at it in a more structured manner. We'll sort of broadly in this podcast, we will look at the Samaj Sarkar Bazaar framework, focusing on the policy response to securing the future of India's growing senior population, and then we look at the markets in terms of the emerging silver economy, and finally the crucial role of society and culture in supporting our citizens. So welcome, Sowmya. Great to have this discussion with you.
Thanks, Malathi.
So let's first start with the Sarkar, our government. And before that, we need to kind of just remind ourselves again that we are, after all, India is the most populous nation. We have more than 1.5 billion and counting. But we are also now the fourth largest economy. And the good thing here is that we have the advantage of being home to a remarkably young population, because 60% of our population is under 35 years at this given point in time. The life expectancy, and this was a really, a fact that I was not aware of, Sowmya, is that life expectancy in India has improved, since independence. You won't believe, in 1947, the life expectancy was just 32 years.
Yes.
And now we stand at around 71 years, in 2025. So, of course, it is a natural progression as the country grows economically, and the healthcare systems naturally will mature, right, alongside.
Absolutely. Yeah.
But, unfortunately, our fertility rate has declined, and it's below the replacement rate of 2.1.
Okay.
And a bunch of factors, right, that contribute to this, from youth education. Of course, we have lifestyle changes. And the most important, the increased cost of living, right? So, the numbers, again, the data points here that I have is by 2050, we expect a senior population, that's the 60 years and plus, to grow from the current percentage of between 7 and 10% right now, to a quarter of our population, that's between 20 to 25, in the next kind of 25 years. So that's a huge leap, right?
Yes.
Also, because the fertility rates are dropping, the median age will only increase in this timeline. So in the same timeline, the next 25 years, our youth demographics will drop by 35 to 40%.
Yeah. Yeah.
So in 2050, right, we're going to be seeing an increase in our aging, like 60 plus, and a drop in our 35 years and younger.
Interesting. In fact, Japan is seeing this at this point, right? Malathi, the aged population is much higher.
Right.
The other population looks at it as a burden because they seem to be, taking care of these things, or even, in fact, the spend becoming lower and higher in terms of expenses in healthcare for elderly, right?
Right.
So, it's only wise that we start these conversations now and, try and see a solutioning ahead of time. In fact, while we discuss, Malathi, I'm going to bring in the longevity report that the Rohini Nilekani Philanthropies, Dalberg Advisors, and Ashoka Changemakers brought out this year. It's like a new way of understanding aging.
Right.
So I'll talk about it with the shift in the narrative and other things, but it does touch upon how we should probably look at things moving forward.
Right. And it's a worldwide concern, right, for
Yes.
countries where the population is aging. But, additionally, for Indians, we're also genetically predisposed to diabetes, cardiovascular diseases, and hypertension. So this, along with dementia, will severely affect our elderly. So that's something that we need to keep in mind from the healthcare perspective also.
Yeah, yeah. So let's jump into the Sarkar aspect of the framework, right, Malti? So given the India's demographic profile, right, that's changing so rapidly,
Mm.
what are the key laws and constitutional directives that mandate the state to focus on senior welfare?
Yeah, interestingly, Article 41 of our constitution, it
Hmm.
actually directs the state to play a role in ensuring public assistance for old age. Okay, so it's there in our constitution. This is especially relevant now in our rural areas where 60% of our population reside.
Yeah.
By 2050, by the way, this will be a 50-50. We'll have 50% in rural and 50 in the urban.
Hmm.
So many seniors, right, currently rely solely on family support,
Hmm.
and unfortunately, that is fast diluting with migration and urbanization. And I'm talking about the seniors in the rural areas.
Hmm.
So, and also the increasing, nuclear families that we're seeing, and along with the expenses, increase in living expenses in the tier one cities.
Hmm.
So we're seeing that because of this as well. In 2007, the specific legislation that was introduced because they found increasing incidence of neglect.
Hmm. Hmm.
In 2007, they brought in what was called the Maintenance and Welfare of Parents and Senior Citizens Act. So
Okay.
basically, this provides a crucial legal safety net,
Hmm.
establishing kind of legal implications if children or heirs fail to provide for their senior parents.
Hmm.
So this kind of provides that safety net, and this law is particularly vital because there's an alarming increase in both physical as well as psychological abuse.
Hmm. Hmm.
And the data doesn't really reflect it as much. There's a lot more going on, especially among widowed and uneducated women. That's what
Hmm.
has been noticed. So this is something that really needs, and it's good that they brought this in. So unfortunately, a legal legislation has to be brought in just to ensure that we take care of our parents, right? It's unfortunate, but yeah, that's where we are right now.
Yeah. In fact, just to further that, right, Malti,
Mm,
the most significant government policy initiative that was addressing healthcare access for the elderly today, right?
mm,
Particularly regarding, like, say, financial security against illness. Like, what do you have to say about it? Because a lot of times we do hear people who can probably pay for their health expenses also rethinking when a surgery is suggested, or some sort of ailment that requires a little bit of health spend to happen, right?
right,
You see them being overly concerned, and then you realize actually they have assets which cannot be liquidified immediately because they are in a phase where they can't do the running around of it, or they think that they don't have the financial capability to pay for that treatment because they just don't know how to go about it, right?
right.
So what is it that you have in this context?
Yeah, so the government has actually significantly strengthened its healthcare safety net compared to what it was like maybe a few decades ago. So, as of September 2024, the launch of the Ayushman Bharat, that's the Pradhan Mantri Jan Arogya Yojana, PMJ, it's known as, it
Hmm.
was expanded so that all senior citizens aged 70 years and above, so this is regardless of their economic status,
Hmm.
they are eligible for free health insurance cover of up to 5 lakhs per year.
Okay. Huh.
So earlier it was limited to only a certain sector, but then this is a certain economic strata, but now it's expanded to all. So the scheme kind of provides a top-up cover for seniors who already have families covered by the scheme, and it also ensures that they receive kind of a health card, under the PMJ.
Huh. Huh.
So that's something that came into effect from 2024.
Hmm.
Beyond the insurance, right? We have, in fact, in June 2025, draft of the revised national policy for senior citizens, the NPSC,
Hmm.
that was announced.
Okay.
And it promises to be comprehensive and address the limitations of the earlier outdated NPOP.
Hmm.
This was back, I think, in 2009, if I'm not mistaken. And so this kind of is in 2025. The revised version has a number of schemes under its umbrella. It again focuses on geriatric healthcare through the Ayushman Bharat,
Hmm.
the schemes that already exist. There's
Hmm.
also financial security and productive aging, with employment opportunities,
Okay.
and
Okay.
also housing for BPL, like below poverty line.
Okay.
And there are a bunch of things, that challenges that the elderly face, especially those in the rural areas, because the digital literacy also is very limited.
Yeah. Yeah.
So that has also been brought in the recent 2025 draft. Of course, it's still yet to be firmed up. But with these schemes, like the different, like the senior citizen savings schemes, the pension schemes, welfare schemes that have come up,
Mm.
and it's a good thing. It's moving in the right direction. Only thing, we need to hasten the pace a bit,
Mm.
and also ensure that awareness is there among seniors and families, because that is quite low. That has
Okay.
been a challenge, again, because of the 60% of our population residing in the rural. But even
Mm.
in the cities, not knowing where to go to kind of get access to these schemes is there. Sometimes the websites also are not too helpful.
Right.
So one interesting thing which I kind of read up also is about a toll-free elderly care number. So it's called Elder Line.
Mm.
It's
Mm.
hash 14567,
Mm.
hash 14567, and this has been introduced to offer emotional support as well as guidance on things like entitlement and on the different schemes that are available. So,
Okay, interesting. But I'm just thinking aloud. This hash 14567 could have been a little more simpler for
that's
an
true, right?
elderly person to retain, right? I
Right,
mean,
right.
just given memory lapse and all of that.
Hmm.
But I also hear that government is in talks to kind of have an exclusive geriatric care kind of an option, because most of the times it's combined with other care, right? That means
Hmm.
there is waiting, there is other sorts of population which kinds of is going through treatment. So just to kind of make it more, efficient,
Hmm.
they are looking at that. And also there's a booklet that's been released in terms of fall prevention and everything that would kind of cater to the elderly aid and care. Uh,
Right,
so
right.
looks like the protection of senior citizens and the schemes or even insurance is kind of gearing up towards it. But
Yeah.
yeah, like you said, we need to kind of speed up a little more rather than, keep thinking, talking about it, right?
Right, right. In fact, the interesting part, and I'd like to move into the markets bit now,
Sure.
Soumya. So I think the
Yeah.
interesting part is that over the last 3 decades, and
Hmm.
we've kind of seen that the private markets have begun to respond to India's
Yeah.
quote unquote silver economy, right?
Right. Yeah.
So this has been kind of, I mean, essentially, it's also because of since the 1991 reforms, when the
Yeah.
markets opened up for
Mm.
supporting global trade.
Yeah.
That's when we saw the emergence of the silver economy,
Yeah.
where goods and services could cater to seniors, and that sort of gained traction, if you notice, over the last 3 months,
Yes. Yes.
sorry, 3 decades. Sorry, my bad. So in that regard, we're seeing a lot of assistive and health technology. That sector has kind of grown. So can you share with me maybe
Yeah.
some of your experiences in that area?
Yeah, so there's a lot happening in that space,
Hmm.
Malti. In fact, wearable tech has been quite useful. So, a lot of times people used to have challenges, especially with dementia, where, people kind of, if they step out, they don't know how to get back home, all of that, right?
Right.
So, anything that's wearable seems a little more easier. So, there are ones that can be like finger rings or watch, which allow for a GPS level of tracking, right? And
Right.
it's very comforting that even if somebody has forgotten the phone or any other gadget, which otherwise they need to make an effort to carry,
Hmm.
whereas something that's on their finger, it seems to be one of those which will stay with them, right? And
Hmm.
it's easy to kind of help them get back home. But even in terms of motion sensor lights, right, there are a lot of these things that people use, not just in the physiotherapist clinic that you would see, but to activate how their reflexes respond, right? A lot of times you hear old people telling they had a fall.
Right.
Of course, if they're outside in a territory where things are dug up, it's hard. But even in places where there's less friction, you would see that people say they had a fall. That's also because when they fall, the reflex isn't that quick, like, age is not
Right.
on their side, right? That's why
Mhm.
it's highly compromised. So how do we ensure that, one gets trained, like as much as one invests in cognitive level training, right? People do
Mm.
Sudoku, wordsmith and stuff like that, where they have this ability to kind of keep their cognitive levels active.
Right.
Similarly, for physical levels as well, there's a lot of motion sensor related reflex oriented exercises, as well as things that people can buy and invest in, very very easy to even host it inside a home setup, and also create like an infrastructure that will ensure that has sensors to kind of trigger any sort of emergency situation. right? So a lot of these things have come into the market, and I think even diet is becoming very complementary in that sense, right? A
Right,
lot of
right.
people have become very cautious in ensuring that they go for regular tests, and then they follow up on, medication and other things. Like you said, now the new 60 is actually the 40s, right? So
Mm.
it's like the duration that we're all spending on this planet Earth is much higher than probably our ancestors did. So here I think diet complementing with all of these fall prevention aids, the wearable technology, the motion sensor equipment, all of it is complementing to ensure that aging is, not highly compromised living, but
Mm.
more in the context of making it comfortable and convenient as well.
Yeah, and this is it's amazing that it's actually growing now at 12% annually, Sowmya, this area.
Yeah.
There's
Mm.
telemedicine, there's the health
Yes.
monitoring apps, like you spoke
Mm.
about. So
Mm.
I think it's also helps seniors to kind of live independently,
Yeah.
right? And I think that's also important, or not always kind of being, under the kind of watchful eyes, so to
Yes.
speak, of other family members. Sometimes they do need the independence, and I think we need to respect that.
Yeah, and also you would know that a lot of people, especially while they're aging, are highly compromised with vision and hearing, right?
Right,
So
right.
even with hearing now, with Bluetooth and everything being enabled, they
Mm.
can consume entertainment. They can also respond well to the place that they're in, not having to worry about not being able to hear, right? So similarly for vision also, there is a lot of tech that helps them to kind of cope with their daily comfort of life, right? So
Right.
it's not highly compromised like it used to be in the past.
Yeah, and I would want to kind of have talk a bit about the private home care agency, Soumya, because I think you
Sure.
and I have kind of have some experience using them.
Yeah.
The expansion of geriatric healthcare services, and which is a good thing, right? Over the few decades, right? There have many agencies that have mushroomed, catering to seniors who
Yes.
kind of need a 24/7 attendance or even registered nurses. In fact, you can have a complete ICU setup in your in the comfort of your home if you'd like,
Yeah.
right?
Yeah. Yeah.
Especially chronic ailments. But this has sort of mushroomed into an informal sector.
Yeah.
And in fact, I recently had a personal experience where I contacted an agency to get some lady attendant for my parents. And
Mm.
they sent a girl. Of course, I did the initial checks. I did the video call, spoke to
Mm.
her, and I found everything okay. They sent the girl, and then after she comes home, she tells me she has sprained her right hand. It's hurting a lot, and she can't kind of
Mm. Mm.
obviously work. So,
Mm.
we kind of have to pay out the registration fees. We got to kind of negotiate them with them upon the daily, daily wages that, or rather the daily fees that they charge, and it's quite a bit. It comes up to, it can be anything from 900 rupees a day to it can go up to 1,500 based
Yeah.
on the skill
Yeah.
level of the
Mm.
attendant. And so these checks, even agencies, kind of, because it's an informal sector, they're not
Yeah.
accountable. You can't hold them accountable for ensuring that the attendant is
Yeah.
there's a good match between the requirements and the attendant that they're serving, right?
Yeah.
In the end, I couldn't get my registration fees back. They said, "Oh, we didn't know she was injured.
Mm.
She
Mm.
never told us." So, which I
Mm.
think is very irresponsible, and we see a lot of such cases, where there are times, at least here, I am with my parents, so I knew what was happening. But in cases where the children are away from are living away, right? They might be living abroad, and they're kind of doing this remotely.
True.
Then the seniors are at the mercy of the agencies and the attendants that they send. And
Yeah.
so we see a lot of asymmetric information there as well, and a bunch of market failures, which our policy should address.
Mm.
Because
Mm.
otherwise, especially with many of the attendants who come, they're usually in that 18 to 26 age group, and they're from remote towns,
Yeah.
where they're coming in only because they want to kind of make a quick buck, and can't blame them. There are opportunities in the city, so they do come. There's a demand for it, and there's the supply is limited, so they do come in. But then
Mm.
they provided only basic informal training, so they don't know, they don't come with that passion to be wanting to care for the elderly, right? They're just coming here. It's like a job for them. So
Yeah.
the multiple levels in which even policies and the government has to intervene to
Mm.
ensure that this is a more regulated sector, because otherwise it becomes difficult for even those requiring attendants and other caregivers, like even registered nurses, where it's one needs to be that much more careful, right? It's because there's a medical aspect of
Yeah.
it.
Mm. Mm.
So this is one area that we really need to see a huge shift.
Yeah, yeah. In fact, I think the traditional old age home is now moving towards assisted living kind of a concept, right?
Right,
So a lot of apartment complexes also have smaller spaces like with 1 BHK, which is more friendly for elderly folks or senior citizens to be housed. And, with being able to manage easily, maintain those things with very less friction points. And even organizations like the Nightingale by Subrata Bakchi, they have something called as an active aging program,
right,
which is online. And earlier they used to do offline here in JP Nagar, where people can go for sessions like, one is cognitive level things that they would do, plus chair yoga and things like that, which are more friendly for them to kind of adopt into. But there is Sukino, which has like the rehab post surgery, or a Dvitiya, which is like into assisted living. I would say that conversation or the economics of it seems to be picking up. Now, most places are offering these options so that, the elderly kind of move into an apartment space which is more safe than independent homes, right? Um,
right.
but my biggest concern, or rather, even with the RNP report that I see, is they are looking at the narrative to be shifted from aging, to not look at aging as a decline, but more as a potential. And I
Yes,
feel that has to, emerge more strongly, because there is opportunity, and, the participation levels can be much higher and not stop at 60,
mhm,
because most people end up retiring. I think that huge vacuum that they see in
right,
their lives, from an active life to leading very dormant life, right? That is what affects a lot of people, both cognitively and, I would say, physically as well, right? Being
right,
active.
right.
So that was a very interesting thing I saw in the report. Of course, it also indicates that enabling older adults who wish to kind of re-enter the workforce, it could boost up the GDP as well, right? We're not looking at the economic side of these things. And I think the quality of life for elderly, right? How do you look at economic security, health, well-being, or even freedom to participate in a lot of things, or having that social connectedness? I would say that's something that all of us as a community should work towards. And Malti, just to give like a quick segue into very simple things that I've been able to do in our apartment complex, is just ensure that, the elderly folks have a place where they come to the terrace and
Oh, that's
spend some
nice.
time. Multi-generational, right? You
Mm,
see younger kids and older people mingling, then there's music, they come and draw or read,
mm,
and sometimes there's just small sessions by different people who are working in different spheres. But just having them in the conversation helps, because a lot of times otherwise they seem to be excluded, and having it in a community level makes it far more easier, because they
mm.
don't need to travel to a place to get this kind of an atmosphere, right? So I would urge, or rather say, that apartment complexes should aim for like having a little kind of an helpline, not like a medical emergency helpline, but
Mhm.
if some elderly
More
person is
informal.
stuck with, say, some tech issues or something like that,
Right.
they feel very helpless now, and they can't trust an outsider to come and do these things, though there are some agencies now helping with entertainment and bank
Mm.
accounts and other, confidential stuff as well, with enough safety net to make sure that's not misused. I would say there's enough scope for us as a community to work towards that.
Yeah, absolutely. And since you're talking about the society, I'll kind of I would like to continue from where you left.
Hmm.
I think society's role is very important here, right? In the
Yeah,
past, traditionally, India's societal norms was more of a holistic ecosystem, right, where
yeah,
generations sort of lived under one roof because there
yeah.
were joint families and everyone's in the same in the neighborhood. So collectively, the caregiving responsibilities were shared.
Hmm.
Nobody thought of it as caregiving. In fact, we're putting these words now because
True.
it's of the. Because it
Absolutely.
was like, yeah, you care, you're taking care of granny, or you're just spending some time with grandpa. And that's how it used to be, and we used to enjoy it. I still remember, those special moments that when I was responsible for taking care of my granny. So whenever we stepped out of the home, I was the one who would kind of ensure that I'm with her, ensuring that she gets her meals on time, all that, right? So it was fun. It was really fun stuff. It was not. It didn't never felt like there was an
Yeah.
additional thing entrusted to us, right? But however, now that whole joint family system is giving way and to the nuclear families, and it's all due to the increasing migration and urbanization. So you can't really blame anyone here. But the shift also means that many seniors would not have really planned for their retirement, right? So economically, also you touched upon that as well. Economically, they might have assets, but then they haven't liquefied it, right? They would have thought, okay, I'll keep this for my children, and that's what the mentality was even earlier in the earlier generations, where they said,
Yeah.
well, the what I have, I'll buy this property or these assets, and my kids can have it. But unfortunately, that also means that as cognitively they decline, they will not be able to liquidate those assets and use it for themselves with increasing costs of healthcare and other things, because they're living sort of independently.
Yeah.
So I think that mind shift also should happen even in people, because we all know at one point in time, all of us are going to be in that senior kind of category, right? So can we think of retirement? Can we plan for it and not expect our children to take care of us, right? I think we should. That's the mindset shift, which is already happening, from our generation onwards, I
Yeah.
would say. And it's crucial because society also must accept aging
Yeah.
it's a natural progression of life. It's not a disease. Unfortunately, we always think of it as, oh my goodness, somebody's getting old. So, I mean, a society must kind of nurture a culture that sort of promotes and respects and values the elders as
Yeah.
valued contributors, right? There's so much of tacit knowledge they have. So the focus should be to ensure that they're not isolated socially, they're not neglected, they
Yeah.
don't feel indifferent, because most of the time, because of the hearing loss, or even the cognitive abilities, or the failing eyesight, right? It sort of erodes the dignity of how they live as well. And they might not say it as much, but if the society around or the community around, like you mentioned in the RWAs, if you can just kind of integrate them into the day-to-day life, right? They're not going to feel like they're getting old, right? And that it's a quote unquote burden for someone else, right? They're going to enjoy that process because it is naturally a natural progression of life.
Mm.
So communities must be kind of, I would say, also be sensitized to seniors' rights, and kind of possibly help them. So maybe, let's say in the RWA, let's say seniors around us who might not have that help, that or maybe their children are not there, or they don't have anybody to take care of them, right? The different protection mechanisms, the different help groups that are there, so that they can also sort of know that they know they can go to someone, right, in case they
Yes.
need help.
Mm.
I think these things are important to help them feel wanted, and help them sort of also ensure that they are playing a more active role in society and not just being a mere spectator.
Yeah. Totally. Yes.
Right. So, of course, the last part I just wanted to mention about is, I think, it's good from a urban planning perspective,
Mm-hmm.
that urban planners sort of design and innovate age-friendly infrastructure, right? And that's something that we kind of need to have as the population increases. This sort of includes ensuring barrier-free housing, developing accessible parks and walkways. I mean, I mean, we are in Bangalore, right? We know we don't have pavements sometimes, but then
True.
having accessible parks, having those ramps, guaranteeing safer transport, and the healthcare access points. So I think these sort of things, from an urban planning perspective, it sort of encourages also active aging. It
Yeah.
also helps seniors step out without kind of having to face the brunt of the dangers out there, from a safety perspective, and it increases their self confidence also in that process.
True. True.
Process.
Yeah. Yeah.
Yeah.
Think.
So, any closing thoughts, Soumya, before we just wrap this up?
No, I think as long as at least I see the fitness quotient is
Mm,
improving, right? Overall, our awareness about being fit, or even the merit in eating healthy food, all of that has upped the game, in some
mm,
sense. But also, just being able to track these parameters and be cautious about anything that's genetically come, or anything that one can anticipate, will just help in ensuring that health crisis can move people to poverty, right? One health crisis, and we hear that a lot of people just have to invest all their savings in, getting treatment done. So
Right.
in that context, elderly care also is more prone to all of these situations. So just making sure financially, mentally, we are more active and more invested in this as a nation is going to, be the solution, or is going to ensure that the aging population embrace aging in a more gracious way. So I think as a country, as much as food is so much part of our lives, the exciting part, fitness, health, and even happiness for that matter, I think as long as we're all able to kind of work these things out, we'll be more sorted.
Yeah, absolutely. Yeah. So there's lots to be done here, especially also in the informal care sector that we
Yeah.
spoke about. I think that's a very crucial area that shifts have to be made.
Yes.
Right. Yeah. But thank you so much, Sowmya, for being part of this podcast. There's a lot of work to be done, and we hope that these conversations trigger some positive changes even in our policy side or from the government.
Yes. Yes.
Thank you
Thanks,
so much.
Malathi. Yeah.
Yeah. Thanks, Sowmya.
Yeah.
And thanks everyone for listening in. Bye bye.
If you liked our show, dive into Takshashila's research on technology, strategy, and economic affairs. Check us out at our Twitter handle @Takshashila INST or our website takshashila.org.in.